Welcome everybody. Janet, thank you. Hope everybody's feeling okay. A little smaller group today. Must be the summer. So I have couple of updates. I don't have any topic for today except for just a couple of COVID updates. Yeah, and then we'll do Q&A. Again, as Janet mentioned, if you have questions, it's best if you type them. However, if you, for whatever reason, can't do so in the chat, then just make sure you raise your hand so that we know that you're asking a question. The way to do so, there are a couple of different ways you can do this. So there's this button React. So what you can do is you can click on it, and there's a thumbs up, so you can just put thumbs up. There's also raise hand, so it's going to look like this. You see what I just did? So, and then there's also, once you're done with your question, you can just click lower your hand. So that would be the best way if you're asking for questions. So there are two main updates. So one, there seems to be a movement on vaccines. As I predicted, the vaccines are going to be moving in the new updated boosters a little sooner than last year. Last year, I think we got them, I want to say late September or maybe even early October. It looks like Moderna is ready to release their shot, and they're also going to have a combination shot, which is the flu and COVID at the same time. Now, I am not comfortable recommending this combination for various reasons, but the main reason, it is an mRNA vaccine. So Moderna now doing two mRNA vaccines, put in one against flu, once against COVID. They just did get authorization, so they will be ready in a couple of weeks. Again, why I'm not recommending, my position, I think that there are more side effects with mRNA versus the older style. So I would still recommend getting a regular DNA vaccine. Whatever will happen in the fall, we can talk about that. I mean, obviously the flu shots are not due, we're not due to get them till probably, as I usually recommend, late October, maybe even up to late November. Flu season doesn't start until later. Now, the COVID, on the other hand, is here now. So there is this two variants. The biggest one currently spreading, which is the Nibus, which we talked about last time. If you have questions about it, make sure you ask me. But I don't think I'm going to talk about that one. And then there's a new strain, which we don't have yet. But there's a strong prediction that it will be here very soon. I'm looking for the name. It's just information on this second one that's going to be prevalent probably in the upcoming weeks is coming from China. It's, I think, XFG, or maybe it's XPG. That's what I'm looking for. If anybody have a second and can find it, let us know. I believe it's XFG. From my reading, what I just did on this a few hours ago, it's a brand new strain. So it's actually a mix of two different strains. It's not going to be an Omicron variant. We don't know whether it's going to be a lot different. The prediction is that it's going to respond to the vaccine and it's going to be quite similar to what we've seen before. Why is it not necessarily good news? Well, it's not a good news because it looks like this new variant is going to be quite significantly different from the other ones. That could lead eventually to continuous number of mutations, which we're going to start seeing a failure of the vaccine. So that's a concern. The Nimbus seems to be responding to vaccines the exactly same way. And the only difference, as I mentioned last time, is that people get this really strong sore throat. Now, how will the new variant be different? Hard to say. And then there's a kind of last third thing, which is kind of concerning. It appears that the newest Omicron subvariant, including the Nimbus and the one before, giving a higher post-COVID or long COVID percentages. For the many months, if for more than several years, I think everybody thought that the risk had dropped quite a bit to less than 5%. They're predicting this new one, the risk will be between 10 to 20%. So 1 out of 10 people will develop chronic long COVID from this new virus. So I think it actually tells us we have to be a lot more vigilant. We have to treat supportively early symptoms. I doubted that the Paxlovid will play any significant role. In fact, I doubt any medication will play a significant role. It seems like I had several patients who somehow got Paxlovid. It didn't seem to do anything whatsoever with this new variant. So I think aggressive supportive care, vitamin C, zinc, immune support, good hydration. If you like idea of homeopathy, you can definitely do that too. And fingers crossed that you're going to do well with that. So that's the current until we get updates on the boosters, and then we can have a clear discussion. So with that, that's all I have for today. I don't see any questions, but I'm open to questions. We have 5 minutes or so to do Q&A before we head it to David. No questions. Well, it's fine. If there's no questions, we can have more
Misha,
time.
I don't know your view on your camera, but it looks like Jennifer is raising her physical hands,
Oh,
but maybe not her virtual.
yes, Jennifer, please go ahead and let's unmute you somehow. Yeah, you're not unmuted. You got to unmute. There we go.
I did put a question in the chat. I don't know why it's
Oh, I don't know why I didn't see it. Now I see it. Any specific international? Not really. I mean, if you're going to the Europe, not a third world country, I don't necessarily recommend taking much of medications with you. I mean, I guess the key question is, do you vaccinate to get the booster now?
Well, I had COVID, probably not Nimbus, probably the slightly older variant. I had COVID about a month ago.
I don't think you should be getting anything for at least a couple of more months. When are you leaving?
Tomorrow.
No, just go. Just mask up. Mask up in a very crowded areas. It's a long flight. You're gonna have to take the mask off during the flight. If you want to mask up for part of the flight, you can also screen the environment, nobody coughing. You can probably just take off the mask for the flight again, because they're supposed to filter now, and it's especially if the plane is not super crowded.
It'll be crowded because I think everything's crowded these days.
I don't know. I had a flight some weeks ago. It was half empty plane, which I was surprised. I think I did a talk in Maine Medical Center, and so I flew to Boston. It wasn't a booked flight at all.
Well, this is going to Poland.
Yeah, so Kim putting a good point. No one wearing a mask over there. I think actually Europe has a smaller numbers right now than us. I think we have a faster growing, but it's everywhere. It's a little bit everywhere. So at this point, make sure you take your favorite vitamins with you, your basic supportive stuff, probiotics if you're going to travel to any areas where you may have had higher risk to get some traveler's diarrhea, but otherwise just a basic support, whatever you're usually taking. Long flights are quite stressful. I think we talked a little bit about it at some point, that one of the biggest problem on the flights, which people don't realize, planes are not fully pressurized. So what that means is that when you're on a pretty high altitude, you're not getting enough oxygen, because if the cabin would have a normal pressurizing compared to the sea level, we would get whatever the oxygen comes through, which is the standard. But if you're in a partial pressure, and I think it's like 0.7, you don't get a full oxygen in, because you're under lower pressure. So if the same amount of oxygen gets mixed into the cabin, you're not getting all that. So one concern with that is a long flight almost looks like you're in a slight hypoxic state, so you're getting less oxygen. It's a relative issue. I doubt most people need to worry about it. I would say that I probably would worry about my Alzheimer's patients who already have sleep apnea, or who are already known to have a negative impact from low oxygen during the night. So those people I would worry about, and anybody who I'm actually worried about dropping oxygen, like to somebody with the lung conditions, etc. Of course, planes generally have capacity to give oxygen, to give full oxygen. So if somebody gets really sick, they can do that if needed. So that's not really, but that's not what I'm talking about. I'm not talking about getting really, really sick. I'm just talking about it's a stressor on a system. So, we need to try to balance it with trying to just get more support. Better sleep. If you like adaptogens, by all means. I think that's a really good idea to take some stress adaptogens.
What are those?
So there are different ones. I like, it's a Chinese formula. Maybe David can say more. It's called Gan Maoling. It's often, I think that's how it's spelled. It's often given at the first hours of the common cold, but it can also be used as a prevention of the colds. And it's not I often would take a couple of tablets before I load on a plane. I find that's a pretty, there are similar ideas. You can also just take something like emergency before you load on a plane, right? So you can take different ways to support the immune system. You can take more vitamin C with more minerals. You can take adaptogens like Chinese medicine adaptogens. You can even take a regular Western adaptogen, things like rhodiola. Like there's one product I like. It's called Adrenal Assist. I like it because it's a very mixed formula. It's in capsules, and you can take a couple of capsules when you feel run down. So, so sometimes I would take something like this with me to the different, especially if I travel and I expect I need all my energy. So I would take some of these products to make sure that I'm kind of capable of quickly getting over acute stressors. I can probably give a little talk on this completely. Like, I think that's sort of a, how do you get around stressors of travel? Maybe we can ask either Deidre or Mariana to talk about that. That'd probably be a good talk. Is ashwagandha root good for this? Not really. I mean, ashwagandha is more of a, it's a wonderful adaptogen, but it doesn't really, it addresses the stress for sure to some degree. But it's more of a calming kind of, it's really good when your stressors are more of psychological than physiological. I think when you have more of physiological stressors, my favorite ones are Schizandra and rhodiola. And then mushrooms. So maitake, reishi, shiitake, cordyceps, probably lion's mane. So those are, but I like the like, for example, Adrenal Assist is a mix. It has a couple of different things in there. So let me see if I can pull it up. Well, I don't actually want us to spend a lot of time. If anybody have questions, I think I rather we do the separate talk on this, but let me look up the what's an Adrenal Assist real quick. It's the product is by a company called Vitanica. I'm gonna give you what's in there. There's a little bit of C, a little bit of magnesium, a little bit of zinc. And then, as I said, there is an rhodiola. There is ashwagandha in there. So they put it in there. So they think that ashwagandha is good enough for a general acute stress response. So oh, this is not gonna fit. Okay, let me just do it this way. So this is what's in this formula. You got a couple of basic minerals, and then you got this adaptogenic herbs, and then other. By the way, that's ChatGPT is wrong. Astragalus, holy basil, schizandra, and maca, they're all adaptogens. So it's just a mix of different adaptogenic herbs. Very simple formula. Not a lot of side effects. The only thing I would say, if part of your stress response is poor sleep, this may not be the great product. You may have to be careful. This may be too stimulating. For some people, Schizandra and rhodiola may be a little overly stimulating, so you have to be careful. Although holy basil and ashwagandha would be more of a calming herbs. So this is kind of a mix. It's a mix of a little stimulating and then some calming herbs. But definitely have something similar to this in your bag of tricks, so to speak. Jennifer, unmute again.
How about combining it with melatonin?
Yes, sure. No problem. Yeah, of course. You can always combine melatonin with pretty much anything. Just make sure you don't take a huge doses. There's no need to take doses more than a couple of milligrams for jet lag and for travel. So remember, at those low doses, melatonin is not a hypnotic agent. This is really important. People get this confused. It's a circadian rhythm reset. So if you travel, your timing is off, melatonin is perfect because it will help you to reset your circadian rhythm. But if you're thinking that you need to fall asleep and you're going to use melatonin, good luck. It's not going to work. You'll need something really soothing, like something like GABA or L-theanine in different combination with other things. Yeah, it's more for jet lag. Yeah, and the jet lag is very big stress on the system. That's why I'm so aggressive about having people to have tools with them. Don't presume that jet lag is benign. You'll recover, you'll be fine, but all of those things in any shape and form they come to you, they are stressors. So you have to respect them as such. And I find that a lot of people don't think that way. They're sort of like, oh, not a big deal, I'm gonna fly 12 hours. Well, it's not a big deal if you set your mind on this and you know how to get over it. But if you're flying to vacation and then for 2-3 days you're resting after the flight, not ideal. All right, well, I'm at 2:20. If you got any other questions, type them in. We'll see if we have a minute to answer them. If you're my patient, you have something for me after, I'll stick around as usual at 3 o'clock. And David, thanks so much for coming. So good to have you, and we'll pass the baton to you.
Thank you. And I always learn so much every time I'm able to be here or I'm able to watch what you're posting and videos like this. So I'm going to go ahead and share my screen. Please do let me know if it's not coming in properly. Okay, hopefully now everyone can see a slide. It's a drawing. That looks good. And then if we go forward, we see some tools, kind of like what Misha was talking about before. And I'm going to minimize this over here. So this slide really could easily be any of us, our friends, our family, or people that we work with. A lot is happening right now in our daily lives, and it sometimes feels like it is nonstop and coming from every direction. So it can be very easy to feel overwhelmed. So for times like this, it's helpful to have these self-care tools. And this next slide, I think, is one that I had shown last time. This is one of my favorite slides. Tools are force multipliers. One can dig in the sand either with a small plastic shovel or with this giant piece of machinery, and you are going to get very different results. Or conversely, you can also dig with your hands. Some practices resonate more with others than others. So this is why I love so much what Janet and Misha do here every week, bringing in different people with so much information to share and using the platform of Zoom and video. So you guys are inspiring me to do more like this. So it's important to have a variety of tools for different people and for different circumstances, and ideally tools that can have the greatest applicability to the most people. Because we are so busy in our lives and we may not feel like we have time to fit in anything more. But what this slide is showing us are all great opportunities to do a practice that I'm going to share with you today. And what I like about this tool is that you can use it even if your space is small or the circumstances don't allow you to move around and do a physical practice like the one we talked about last time. So this is something that you could do on the train or even on the plane. It sounds like some of you are going to be traveling here very shortly, or if you're recovering from surgery or perhaps you're wheelchair bound. So all of these are applicable. Today, we are going to talk about and learn and practice the May healing sounds. And as a reminder from last time that we talked about it, May is a mountain in China where this information came from, kind of similar to Shaolin and the Shaolin monks. The healing sounds are not something new, but are rather very old. In fact, over 1,000 years old. And they were passed on from lineage holder to lineage holder. And they're very accessible, they're easy to learn, and it's useful. Just mindfully listening to them can give you a benefit. Qi or energy has many different forms that can be affected in many different ways. And because of that, Qigong or energy cultivation is more than just those Tai Chi-like movements that we learned about last time. Here, our goal will be to harmonize the vibrations of the internal organs. The organs are always playing their own individual frequency or sound. And those sounds interact with one another. And like a symphony, they play together with harmonies and resonance. And it looks like my video is a little bit choppy, but don't worry, everything else is going to be in audio. The creators of this practice, again, many hundreds of years ago, did a lot of meditation and found that the vibrations that it created went to different areas of the body and provided something like an internal massage. Other benefits can include those that are gained from the gentle, relaxed, deep breathing. And some of you already might be working with 4-square or 4-6-8 breathing. So there's benefits to all of these and other types of breathing exercises. Additionally, by focusing our attention on the body when practicing, a mindfulness component is added by literally being aware of and listening to the body. And something like a mini meditation is achieved that helps to center and ground yourself. The masters of the past were also able to notice that the subtle energy of the organs were balanced by the healing sounds, almost like this idea of tuning an instrument. And when the whole body was in harmony, playing together like a symphony, then external symptoms were relieved. Here we list things like pain or swelling, numbness, tension, anxiety, worry. So the physical body, the emotions, and everything all in between, they're all connected. And it only takes one out of harmony instrument or body system to throw off the rest. In Chinese medicine and Western too, we're always looking at things that are out of balance. Maybe it's the blood tests that are increasing or decreasing. Timing can be important too. If there's something that is coming early or late, this could be significant as well. And also things from the external environment. There can be injuries, you might have strong emotions, and other things as well. So the goal is to get the individual organs and then the whole body back into resonance. And we do that through the understanding of the 5 elements of Chinese medicine. All things on the earth can be described using the 5 elements. So a little bit about that. This is a visual of the 5 elements in what we call the generating cycle. At the bottom, it also says this is the giving birth cycle. Each of these are paired with organs of the body. So the wood element is paired with liver. Then this is the Chinese liver organ. Fire is then paired with heart. Earth is with the spleen. And metal is with lung. And lastly, water with the kidneys. And there's also a way that the elements and organs balance and keep each other in check. This is something that we call either the controlling cycle or the restraining cycle. And this is going to be important for us later on today. And we will see this slide again a bit later on. Emotions are paired with the elements as well. So in doing this practice, we get a calming and balancing effect of the emotions as well. And I know this is a lot of information, but don't worry because there's a handout that Janet has with all the important information from today. And I know that she's going to share it with you all at the very end. Another consideration is the season. There's an association between the sounds, the elements, and the organs with the seasons. But that is, again, something that you'll be able to see on the handout, with the idea being that you can practice more of the healing sound associated with the current season for a greater effect. Regarding breathing, during the practice, we can either use abdominal or chest breathing. But importantly, there are a few things to remember when practicing over time. We say, do not hold the breath. You would like to avoid that. When you're breathing, have the inhale and exhale be as complete as possible. And when we're doing the breathing during the process, to try to deepen and slow and soften the breath. This is a great practice just in and of itself, and you'll see a lot of overlap with other different deep breathing exercises like this. But because we are all learning this today for the first time, we're going to listen along to some samples, but always pay attention to your own body and follow what is best for you. So your breathing and your timing, the tempo and how loud you make the sounds are all going to vary from some of the practice that we follow along with. So always start slow and gentle. And when you practice yourself, you're going to want to follow along your own natural breathing rhythm. Another important point for breathing is the mechanics. Whether you are going to be belly breathing from the lower abdomen or from the chest, we want to create space first. We don't want to force the air in. We don't want to use air to inflate. So the little symbol on the right is the balloon that you would blow up, and that is the air that's kind of forcing the space open. Conversely to something, say, like if you had a deflated ball or the mechanics here in the pump, or it is mechanical. And so as it opens up, the air is able to go in. So this is a subtle point, and this is going to be something that we use with our mind intention and something to pay attention to. Again, practicing a little bit like we are today, we're all going to be fine, even if we've got to catch ourselves and go back and readjust it. But if this is something that you practice over time, definitely be aware of this. And it might be a little bit hard to remember, but yeah, just do your best and know that even if you get it wrong, it's going to be okay. You will be fine. So try it out and see which one feels better, whether it's the lower abdomen breathing, what we would call the lower dantian or that lower energy center, or breathing from the chest, which we call then the middle dantian or this middle energy center of the body. And also, too, you can try alternating from one to the other on alternating breaths, if you would like, but that might take some practice to do. But just know if that's something that you feel like the body is naturally doing, to go ahead and to follow that. How and why this or any practice could become a Qigong is through the use of the mind. Here, our focus will be on the corresponding organ. In other words, when we're going to do the heart sound and we are going to think about and put our attention on the heart area. During the practice, too, we're also going to pay attention to the sensations that it brings about for us. Adding the mind is a very powerful concept which amplifies the benefit. And additionally, it will give the monkey mind, the mind that is filled with thoughts, some going into the future, some from the past. It'll give those thoughts that like to go all over a nice place to anchor. So this type of practice or a mantra meditation is very useful to help to get into this deeper, relaxed state more easily. And the order that we're going to follow is this one from the slide before. It's going to help us to create a special balancing effect. And specifically, we'll start working with the fire element and the heart. So initially, we'll go over some of the sounds, and then there'll be a time at the end that we all get to practice together. The heart itself has two sounds. Perhaps remembering something like the lub dub or the thump thump sounds of the heart could help you to remember that. And the first sound is Jen. This tone and all of the other ones, they don't have any translation or literal meaning, but this is just what we've found over the many centuries resonates and works with that heart energy. So I will demonstrate it, and then we'll listen to my teacher one time. Do be ready to adjust your volume if you need to, especially if you're listening on headphones. So right now I'm talking, but as I start to do this kind of singing, chanting, and you hear the audio come through, do certainly please be mindful of that. And again, later on, we'll practice all the sounds together, so feel free just now to listen. And remember that we're doing the sounds that we want to think about that area. We want to think about that vibration in the heart. So here you can think about two if you'd like. There's an outline on that picture of red. So the heart and that fire element, you can think of a red color there if that particular practice resonates with you. So I'll demonstrate now. Please adjust your volume. Jen, 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 Jen. And now we can listen to my teacher.
For heart and blood. Jen, 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 Jen.
The next sound, again, it's also related to the heart. Remember, it has those two sounds. It's dung. Dung is repeated with the breath comfortably as it expires, and you're going to go up and then down. It has this rising quality and then this falling quality as you're making the sound. Again, I'll demonstrate it, and then we can listen to my teacher. Dung, 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 dung.
Dang, 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 dang.
Nice. Next, we'll move on to the sound for the lungs, and that is shung. It's similar to the sound Jen that we're going to repeat it around 3 to 5 times, and then that last time the syllable is held. You can think about the lungs on both sides, and you can envision the color white too, if you'd like. Shang, 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 shang.
For lung and the skin. Shang, 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 shang.
Next is going to be for the liver. This is the liver sound, and it's guh, like the E in may, which is a hard word. I still have trouble too with some native speakers. I will get corrected, but guh. You repeat it and then you hold it, similar to the other sounds that we've been practicing. And just by listening a little bit, you can start to notice the different qualities of the sounds. So the mind intention can be on the right side, around that liver area, and the color green if you so choose. Ga, 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 ga.
For liver and the gallbladder and the tendons. Ga, 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 ga.
The spleen has two sounds, but we put them together. And the mouth really gets a bit of a workout going from the ong to the ah sound. And at the end, there's a bit of a rising tone. The spleen in Chinese medicine is related to the muscles, and the mouth muscles are going to get moving here as we make the sound. The spleen area that we can think about is on the left side of the rib area. And this doesn't have to be an exact place, but just start to envision that there. And then the color here would be yellow. Gong gua, 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 gong gua.
For spleen and muscle. Gong gua, 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 gong gua.
and hi. This sound is a little bit different than the others thus far, where we make the tone and then we are going to hold it. It governs the stomach and the intestine. So if you know you want to specifically work with, say, the small intestine or the large intestine issue, you can focus your attention there. If not, the stomach is a good place to start. The sound is made and almost goes through a complete series of vowel sounds, like an I, A, E quality, and then sometimes going back. Just follow what your body naturally wants to do. You can listen to the variation, and as you practice it, it will come out for yourself. If you like the color component, we're still using yellow for the earth element to bring into that area of the stomach. Hi.
For stomach, duodenum, large intestine, small intestine, and the colon. Hi.
Hey is the next sound, like hey, how you doing? Or hey is for horses. That's the tone. The sound for the kidneys are held like the high sound that we just practiced, but near the end, we exhale and stress the last syllable and push out the remaining air. Again, we are doing this comfortably, so this should be very comfortable to your body, but this is just a slight variation from the sounds that we have practiced before. The color of the kidneys is going to be black, and you can put your mind intention on the waist, below the last ribs on the back as you're doing this exercise. Hey. He.
For kidney, bladder, and bone. Hey. Hey.
This one too, if you can think of it, has a little bit of a quality of the mouth, like an exaggerated smile. The lips come apart a little bit to the side. Lastly, Hong is the sound for the brain, but it shares that same water element with the kidney and the color black. This one we repeat many times. First time you repeat it, it will be slower, and then the next time you repeat it a little bit faster. Hong, 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 hong.
For brain. Hong, 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 hong.
So just a quick recap before we get into practicing together. As best as you can, make the sound. That will come with practice and over time. But of course, know that just listening to these healing sounds has a benefit as well. In regards to breathing, we don't want to be the balloon animal. Again, we want it to be very relaxed, very gentle. You could hear when I was doing the sounds and when my teacher's doing the sounds, we're projecting, but we've practiced a lot. I don't want you to think that you have to make the sounds very loudly. Some people have thought that that's important to do right out of the gate, and they said, "Oh, I have a sore throat." I said, "Don't do that." Again, listen to your body, follow your body and what it's telling you. It's useful information. And incorporate to that mind intention. That is how this practice becomes a Qigong practice. So the different organs and the different areas of the body, we can follow along. And so here's a little chart. It shows the two heart sounds. Lung is a little bit hard to read, but that's that white color there. The liver in green, and it was near impossible to read the spleen and the stomach sounds in yellow, but just know that that's a color that you could use there as well. Yellow, orange, brown, things like that. Kidney and brain are both of that water element, that black color if you'd like to use it. And then lastly, we'll repeat them all together again. So we'll repeat each one 5 times. And it's a good thing that we're muted. I'm even going to mute myself because, like on Zoom, if you ever got together and tried to sing somebody happy birthday, the sound is off, the timing is off, the tempo is off. As you're doing the practice too, you could soften your eyes or even close them as you get used to them. Again, we'll repeat each sound 5 times and then all of them together. And we're doing great on time. This will take around 14 minutes just to quiet your little monkey mind, if that helps. And have an amazing practice. I'm going to mute myself now, and we'll all practice together.
For heart and blood. 真真真真真，真真真真真，真真真真真。真真真真真。真真真真真。噔噔噔噔噔噔噔噔噔噔噔噔噔噔。噔噔噔噔噔噔噔噔噔噔噔噔噔噔噔噔。噔噔噔噔噔噔噔噔噔噔噔噔噔噔噔噔。噔噔噔噔噔噔噔噔噔噔噔噔噔噔噔噔。噔噔噔噔噔噔噔噔噔噔噔噔噔。For lung and the skin. 上上上上。上 For liver and gallbladder and tendons. Ga 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 for spine and muscle. Gong guo, 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 gong guo. Gong guo, 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 gong guo. Gong guo, gong guo, gong guo, gong guo, gong guo, gong guo, gong guo. Gong guo, 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 gong guo. Gong guo, 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 gong guo. For stomach, duodenum, large intestine, small intestine, and colon. For kidney, bladder, and bone. Hey. 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 For brain. Hong 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 hong. Hong 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 hong. Hong 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 hong. Hong 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 hong. Hong 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 hong. I'll repeat again. Jan 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 jan. Dang 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 dang. Shang 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 shang. Ga 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 ga. Gong gua 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 gong gua. Hey. Hong, 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 hong.
And a key highlight of this practice that I like very, very much is that this is a tool that we can easily take wherever we're going. We can use it on our own and then also share it with others after we become more familiar with it. Because there are lots of amazing different sound therapies that are out there. Maybe you've been able to experience some of them before. But this one is useful because it is boundless and it can be taken wherever you are or wherever anyone is sick. So when life is very busy and we're at risk of looking like our opening slide with all the arrows coming towards us, sometimes we just need maybe one thing to help us shift. That one positive influence can cause a ripple effect. Outside of practicing all of the healing sounds together like we just did, you can also practice one sound. I've given many patients and students and friends the liver sound, this guh, as a mini mantra for anger or frustration. This is good if you're walking along. It helps to tonify, but then also release a little bit from that liver organ and helps things to rebalance. Or others really like the sound hong, perhaps, if it's before an exam or a meeting or a stressful talk that they have to give. On the handout that Janet has and is going to be able to share with you all, there are additional correlations that we didn't get into today. But if you're not sure where to start, just know that you can start anywhere. And you're going to begin to build up a rhythm. And once things get flowing normally again for ourselves, then we can get into a good flow state and harmonize better with each other. So you have this one-page handout that's going to go over all of this in more details. You also have this recording. You can watch it again anytime if you want to review the sounds. And contact me if you have any questions about what we did today. And I'm happy to support you with more information about this or any other useful practice. So thank you very, very much. And safe travels for those of you that are. And otherwise, everybody have a great weekend. So I'll now stop my share because I guess you cannot unmute yourself. And I'll look at the chat real quick and just thank you very much for being brave and for trying this new practice.
Thank you, David. This was wonderful. I hope everyone enjoyed it. Thank you for coming. And Janet put who we're going to have next week. We're going to have Mary Naden talk about Alexander technique. Mary actually used to be part of CIM until pandemic hit. And then since we restarted in-person work, we haven't kind of brought her back. But so it'd be good. It'd be great to reconnect with her. Otherwise, stay safe. We are stopping recording.